Hi, my name is Dr. Susan Maxwell. Thank you for joining our webinar today on egg freezing. And we're also going to discuss briefly about some fertility financing options through one of our partners of EggFund. And we're still waiting for Carmela to join us, but I'm going to go ahead with talking about the egg freezing process. So next slide. So again, my name is Dr. Susan Maxwell. I am one of the physicians at Southern California Reproductive Center. I actually practice out of the Santa Barbara office. However, our main location is located in Beverly Hills, and we also have satellite locations in Pasadena as well as Ventura. I am board certified in both obstetrics and gynecology and reproductive endocrinology and infertility. I completed my residency in OBGYN and my fellowship in reproductive endocrinology at New York University School of Medicine. I practiced in New York for about 5 years before moving to California 2 years ago, where I've been practicing predominantly in Santa Barbara. Next slide, please. At SCRC, we are very proud of our proven track record. We've been open for more than 25 years. We have 2 state-of-the-art embryology laboratories, one in Beverly Hills and one in Santa Barbara. Both locations have on-site surgery centers where we perform our procedures that are attached to our laboratories. And again, our locations are Beverly Hills, Pasadena, Santa Barbara, and Ventura. Next slide. What really sets Southern California Reproductive Center apart is we have world-class embryology laboratories, and they are headed by a world-renowned laboratory director. We perform double witnessing verification on all our samples, and we use technologies such as vitrification, which is a flash freezing process, which shows improved outcomes with freezing and thawing gametes. We also have a lot of experience with blastocyst biopsy, and this is the stage in the embryo where we are able to perform genetic testing on the embryo. And we've been doing this for many years and have a lot of great outcomes, screening embryos for both aneuploidy, which are all the chromosomes, as well as for single gene disorders, which is PGTM. We also have embryoscopes available in both of our laboratories, which is really unique. The embryoscope takes time-lapse images of the embryo throughout its development, which helps us to determine which embryos are superior for transfer. Next slide. So today we'll be talking about fertility financing options. And in general, egg freezing, why you should consider freezing your eggs, age-related decline in fertility and why that's important. And then we'll give you an opportunity to ask questions at the end of the webinar. Next slide. So we're going to skip over these slides for now. Go ahead. So what is fertility preservation? So it's basically when patients undergo a process to freeze their gametes, whether it's either sperm or eggs, and these gametes stay frozen until you're ready to use them in the future. And we're going to get into why women in particular decide to freeze their eggs, but the whole process takes about 2 weeks. And it helps to preserve eggs when they are at their best quality, so that when you are ready to get pregnant in the future, you have the option to use these eggs and hopefully have superior outcomes because of that. Next slide. So the reason women consider freezing their eggs is as you get older, both the number of eggs in the ovaries, but also the quality of those eggs decline. And what we mean by egg quality is the ability of an egg when fertilized to make a genetically normal embryo. And what we found is as women get older, the percentage of embryos that they are able to create that are genetically normal goes down. And this is consistent with pregnancy rates, or the chance of getting pregnant in any given month, going down as women get older. And these two graphs are consistent because we believe that the majority of reason why women either have pregnancy losses or they're not able to conceive is because of these genetic abnormalities that are occurring in their embryos. Next slide. The other issue is that women are born with all of the eggs they will ever have. So as a fetus, there are millions of eggs in the ovaries. And then at birth, that drops down to the hundreds of thousands. And then every month, women lose hundreds of eggs per month. So by the time they go through menopause, all of the eggs, or most of the eggs in the ovaries, have been depleted. Next slide. So if you are considering freezing your eggs, when you schedule a consultation, we will take a detailed medical history, and then we do a physical exam and some diagnostic testing. Next slide. Some of the more important tests that we do are assessing the ovarian reserve, or the number of eggs in the ovaries. And we do this with a few different tests. One is we do a pelvic ultrasound, and we look at resting follicles on the ovary. We call these antral follicles. And so here you can see in this image, there are little black circles on the ovaries, and those are the follicles that contain the eggs that are available to be stimulated in that particular month. Other tests that we do to get a sense of ovarian reserve is we do a test called an AMH, an anti-Müllerian hormone. And this is a marker of the total number of eggs in the ovaries. And then sometimes we also do a test called an FSH on the second day of your period, a follicle stimulating hormone. And this, when elevated, can predict us getting fewer eggs with stimulation or having a harder time stimulating the ovaries. Next slide. For men who want to understand their fertility, we usually start with a semen analysis. And on the semen analysis, we look at volume of the sample, concentration, which is the million of sperm per milliliter in the sample, the overall motility of the sperm, and the morphology, meaning how the sperm are shaped. And we use this information to get a sense of if these parameters are normal. Next slide. In patients who are considering fertility treatments or considering egg freezing, we recommend that you have a healthy diet during that process or leading up to that process. And what we mean by healthy diet, that means avoiding processed foods, predominantly eating foods that contain a lot of vitamins and minerals, such as fruits and vegetables, lean meats, healthy diets such as the Mediterranean diet, or eating a lot of plant-based foods such as whole grains, vegetables, legumes, fruits, nuts, and seeds are important. Folic acid is really important for early fetal development for women who are trying to get pregnant, and it can be found in legumes, asparagus, and dark leafy greens. Vitamin B12 is important. That's found in organ meats. And omega-3 fatty acids are found in salmon and different fish. Next slide. The supplements that we recommend when either freezing your eggs or trying to conceive is a basic prenatal that contains folic acid and vitamin B12. This is associated with improved fertility, live birth rates in IVF, and lower ovulatory infertility. CoQ10 is a potent antioxidant. All antioxidants are good for egg health and egg quality, and they prevent DNA damage in the eggs. CoQ10, I recommend taking 200 milligrams twice a day of that supplement. Vitamin D is also has been shown to reduce miscarriage rates and improve IVF outcomes. So we typically check your vitamin D level and then recommend supplementation as needed. Next slide. We recommend avoiding toxins, which can impact egg and sperm quality. Alcohol, so having more than 4 drinks per week, can lower IVF outcomes. Cannabis is also associated with poor outcomes, and it can have some developmental effects on the fetus. And so it's really important that patients who are undergoing fertility treatments or freezing their eggs stop cannabis during that time. Other next slide. Tobacco is associated with reduced anti-Müllerian hormone levels and antral follicle counts, as well as poor IVF outcomes. Next slide. Some patients consider acupuncture during their treatments. There can be many benefits to acupuncture in terms of reducing stress levels, improving sleep, and blood flow to the pelvic organs. It may have some benefit balancing hormones, but most importantly for our patients, it really helps to relieve stress and help them modulate their nervous system during treatments. Next slide. So what is the process in general? So when patients are ready to start their egg freezing cycle, they come in sometimes on the 2nd day of their period, or if we've had you on a birth control pill, we take you off, and then you come in for a baseline ultrasound and blood work. If everything looks good at that appointment, we start you on daily injections. These are predominantly gonadotropins, and what they do is they stimulate the ovaries for the eggs to start growing. As you're on those injections, you do need to come into the office every few days for blood work and ultrasounds so that we can monitor the growth of those follicles, as well as your hormone levels. When the follicles have reached the appropriate size and everything looks healthy, we have you take a trigger injection, which initiates the ovulation process, and then we schedule your procedure to take those eggs out 36 hours later. Those procedures are done in our surgery centers. You get anesthesia, so you do not feel anything, and that procedure takes about 15 minutes. Next slide. So this is a diagram of what's happening during the egg retrieval. We do a vaginal ultrasound and we have a needle attached, and that needle actually goes through the vaginal wall directly into the ovary. And you can see here the needle puncturing those follicles, which are the fluid pockets that contain the eggs. And we aspirate all of the fluid pockets within the ovary. That fluid goes to our embryology lab where they sort through it and they find the eggs within that fluid. Next slide. Once the eggs are obtained, we sort through them and then we freeze those eggs using that flash freezing method called vitrification. We do freeze all eggs. However, eggs will have different maturity levels. The eggs with the highest maturity, called M2 oocytes, are the ones that have the greatest potential of causing a successful, healthy embryo when thawed in the future. Our eggs are stored in liquid nitrogen tanks in our embryology laboratories. Those tanks are maintained with liquid nitrogen, and we have advanced temperature sensors and alarm systems on those tanks to make sure that that environment stays stable. Next slide. When you go to thaw your eggs in the future, about 90% of eggs survive the thaw process. Once the eggs have been thawed and you fertilize those eggs, about 70 to 80% of eggs will fertilize normally. And then once fertilized, we leave the fertilized eggs, our embryos, in our embryoscope, which is an incubator that then takes those time-lapse images. And they develop over the course of the next 5 to 6 days, and they have to reach what's called a blastocyst stage in order to be healthy and be able to be used. About 50% of eggs that fertilize make it to that blastocyst stage. At the blastocyst stage is also when we are able to do biopsy of those embryos to see if they're genetically normal. And the percentage of embryos that are normal is going to depend on the age that you were when you froze those eggs. So we get more normal embryos when women freeze their eggs before the age of 35. Next slide. Once you've had your procedure, you can return to your daily activities the next day. Walking is okay, going to work is okay, but we don't want you to exercise until you get your period, which is about 10 to 14 days after your procedure. The reason for that is the ovaries get quite enlarged from the stimulation process, and they can enlarge to anywhere between 5 and 10 centimeters. And so we don't want you to exercise while they're enlarged in order to reduce the risk that those ovaries could twist. The ovaries will shrink down, and by the time you get your period after your procedure, they should be mostly back to normal. And that's when we say it's usually safe to resume your exercise or physical activity. Next slide. So these are just some frequently asked questions about the process. So when should you consider fertility preservation? This is a personal decision for each patient. The ideal time to freeze your eggs is before the age of 35. Most women are considering this process between the ages of 30 to 35 if they're not ready to start a family yet. It can be done at an earlier age. There are many different reasons why women choose to freeze their eggs. And it can also be done after the age of 35. We have that conversation with our patients. We assess your own ovarian reserve and characteristics to tell you what your chances of success are at that time you're considering freezing your eggs. Patients can do multiple cycles of egg freezing, and you can also freeze your eggs in back-to-back cycles, meaning you can retrieve eggs, get your period 2 weeks later, and then start another stimulation without any harm. Eggs can remain frozen for many years, sometimes 10 years or more lapses before patients are ready to come back to thaw them. Immediately after your procedure, you find out how many eggs were retrieved, and then we call you the next day to let you know how many eggs were successfully frozen. Next slide. So currently at SCRC, we are offering a promotion for egg freezing, fertility preservation, which is 25% off. You can visit our website at any time at scrcivf.com/promotions to look at what specials we are running. Next slide. And if you'd like more information about any of this, you can book a consultation with any one of our physicians. There are 4 physicians that practice in the Los Angeles area, Dr. Mark Suri and Dr. Hal Danzer, who are 2 of the founders of the practice. They are predominantly in the Beverly Hills location. Dr. Suri is also up in Santa Barbara. Dr. Carolyn Alexander is in our Beverly Hills office, and Dr. Diana Shopkin is in Beverly Hills as well as Pasadena. Okay. So if you want to go back to the slides at the beginning about EggFund. So Carmela unfortunately was not able to join us, but I just wanted to introduce to you what is EggFund. So EggFund is a fertility financing platform that helps to connect patients with different lenders that are able to offer loans for family building, whether it's IVF, egg freezing, surrogacy, or adoption. And so what's nice about this platform is that they can help you to connect with many different lenders and see which options are best or work best for you. Next slide. And so we will, when you schedule consultation and you have with one of our physicians and we go through the process, we will connect you to people within our billing department to talk with you about the cost of the process and also connect you with financing options as well as with EggFund. Okay, next slide. Okay, next slide. So now I would like to open it up for any questions that you may have. So if you do have any questions, you can put them into the question and answer section or in the chat, and I'd be happy to answer them for you. So this first question is, what are the drawbacks? Physical pain, or are there any long-term? So there are some risks to any type of procedure that you have done. With going through an egg freezing cycle, less than 1% of patients have any type of complications from that procedure. Things that can happen is you can get some bleeding from around the ovaries because we're poking them with a needle. And this can cause pain after the procedure. And sometimes we have to monitor your blood counts and manage your pain. Infection risk is very low from this type of procedure. Because the ovaries get enlarged, we don't want you to exercise because there's a risk if you do of the ovary twisting. And that's an emergency that requires us to do a surgery to untwist the ovary. The final risk of having the ovaries enlarged from stimulation is a condition called hyperstimulation syndrome. And this is a condition where the ovaries can produce some fluid that builds up in the abdomen for a few days after the process. And this can make you feel bloated and cause symptoms like nausea and vomiting. This goes away on its own after a few days, but sometimes requires monitoring. So all of these things we talked about are reversible conditions. There's no impact to your own ability to conceive from undergoing the egg freezing process. This next question is, if someone's 47 years old, can she still do egg freezing? The limitation of egg freezing at 47 is oftentimes there are not enough eggs to stimulate to have a successful outcome. And the quality of those eggs may be poor, so they may not thaw well. When we see a patient, especially who's in their mid-40s, in order to consider egg freezing, we need to do those fertility tests and make sure that you would respond to the treatment and have a chance of success with that. Next question is, can you talk about the effects of cannabis on egg development? Is it linked to autism or other developmental defects? This is an excellent question. I was just at a national conference where there were some studies about cannabis, and because it's become legal and more accessible, there are more women using cannabis, and there are more studies coming out about the effects of cannabis on early development or fetal development. And the data is showing that there may be some neurodevelopmental issues with offspring in parents who used cannabis at the time of conception. So either coming from the sperm or the egg side. And most of these studies are being done right now in animals. And so there's a lot we don't know, but out of this preliminary data, we don't recommend that you use cannabis when you're trying to conceive. But we hope to have more information about this in the future. So this question, what is your suggestion for the woman who's 47 to do egg freezing? Do I recommend it? Generally, I would not recommend freezing eggs at 47, and that individual should consider conceiving at that time if that's an option. Is there a way to check on the health of eggs before you decide to do this? So we get information about your egg reserve numbers and quality by doing those fertility tests that we discussed. The anti-Müllerian hormone will tell us how many eggs are in the ovaries. The FSH, when it's elevated, that gives us, that is correlated with poor egg quality. Unfortunately, there's no direct test on eggs for quality. The only way to test for quality is once those eggs have been fertilized, we can do genetic tests on the embryos. Egg quality is linked to age. So we have diagrams or statistics on your chance of success with egg freezing based on the age in which you freeze your eggs. And that's data is based on national data of women who have undergone the process at that particular age. Does your mental health / stress affect actual egg health? So stress is something that is very difficult to measure in order to have real data on the effects of stress on egg health. However, in patients who are trying to conceive, those with very high stress levels or multiple stressors, predominantly exercise stress, so heavy exercisers, or patients who have low body weight as a stressor, can affect ability to ovulate or ability to respond to stimulation for egg freezing. So overall, stress may not have an impact, but very high chronic stress with physical stress, we do see affect outcomes. How should we think about egg freezing and storage timing if we might have to move locations or cities? Are there state-to-state considerations? This is another great question. Generally, so you can move eggs from state to state. There are transport companies where you will, they would go into a small transport tank filled with liquid nitrogen and be transported across state lines. However, eggs are more fragile than embryos. Embryos are typically moved across the country. However, eggs, I recommend keeping them at the location where you froze the eggs and thawing them at that location to make embryos. Once embryos are created, then they can be more safely moved across the country if needed. How long before egg freezing should one reduce or stop drinking alcohol and or starting prenatal vitamins? Well, if you think you're interested in egg freezing, you can start a prenatal vitamin now. It is good if you've been taking it for at least a month before your cycle. However, it's at any time you can start it. For stopping alcohol, alcohol has the most detrimental effect if you're drinking heavily during your cycle itself. So you would want to stop alcohol when you start your cycle. What does the pricing look like on average with insurance coverage? So most insurers do not cover egg freezing, with the exception of certain employers offer it as a perk. And so those plans that are employer sponsored to specifically cover elective egg freezing usually cover all of the costs, including medication. For patients who are paying for egg freezing out of pocket with medications, it can cost about $12,000 because medications are a big portion of that cost. We're hoping that with the new deals made with EMD Serrano and Trump RX, that some of those medication costs are going to come down, and that we may be seeing lower costs in 2026. However, we don't yet have the price of what those self-pay medications are going to be yet. So this question is, if you're 33 and you have a child, but you want to wait several years until having another, do you recommend egg freezing? And I do recommend considering it and coming in for a consultation to see what's happening. The reason for that is a good portion of the patients we see have what's called secondary infertility, where they got pregnant on their own the first time, had no problems, and now they are trying many years later to have a second child and having difficulty because their egg quality has declined. And so this is very heartbreaking for many couples because they didn't anticipate this happening, but it is something that happens naturally as women get older, that it just becomes more difficult. So if you are in that situation, it's a good idea to think ahead and get on top of that and see what's happening with your body. Does SCRC do genetic modification on eggs? No, we do not genetically modify eggs. There's no approved procedure right now in the United States to be doing that. We can do genetic testing of fertilized eggs on embryos, but there's no genetic modification that's occurring. There are so many egg freezing clinics. How do you choose one that's right for the patient? So with egg freezing clinics, you want to make sure that they've been doing egg freezing for a long time, but not only the freezing portion, but the thawing is really important. And so because SCRC has been an established clinic for so long, we have a lot of patients many patients have had successful thaws, and that's the most important thing, because that proves that the way we're freezing eggs is successful. So you do want to go to an established clinic that has established protocols for freezing and thawing eggs. What supplements specifically should we start? Is it safe to take a prenatal CoQ10 and vitamin D without getting lab tests done before? So it is safe to start a prenatal and CoQ10. The prenatal will contain some vitamin D already, so you don't need to take additional vitamin D unless you know that you're deficient in that. So I do recommend that you can go ahead and start a prenatal and CoQ10 without any testing. Is the egg quality the age at freezing or the age at thawing? It is the age at freezing the eggs that has the most impact on outcomes in the future. So that is the whole purpose of freezing your eggs, is you want to do it at a young age so that that egg quality is healthy, because the uterus does not age in the same way. So women can carry healthy pregnancies up until age 50, but it's the egg quality that declines over time. Mm-hmm. Okay, good. So I see that we've answered all of our questions here. So if anything else comes up, you have any other questions, I encourage you to schedule a consultation with one of our physicians, and we'd be happy to evaluate you and go over your specific needs. Mm-hmm. Mm-hmm. Okay, thank you. Mm-hmm.